Why do podiatrists never cut their toenails in the shower? This common morning habit is the hidden reason for many ingrown toenails, but there's a simple solution that many doctors aren't sharing. The problem isn't your technique, it's your timing. I'm Dr. Andrew Schneider, and after treating thousands of painful ingrown toenails, I've discovered something that might surprise you. That relaxing shower routine you think is softening your nails is actually setting you up for disaster. Here's why. Soft, wet nails don't cut cleanly. They tear and split, creating microscopic damage that can lead to ingrown toenails. But here's the thing, nearly every article and video about ingrown toenails focuses on cutting technique, completely missing this crucial factor. Today I'm going to show you the 2025 method revolutionizing nail care. Not only will it prevent ingrown toenails, but it will work even if you've been struggling with them for years. Before I reveal this method, you need to understand these 3 critical mistakes that even nail professionals make. Hi, I'm Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Let me explain what's really happening when you cut your toenails after a shower or bath. When nails absorb water, they become soft and pliable, which sounds good, right? But here's what most people don't realize. Soft nails tear instead of cut cleanly, creating microscopic splits that can grow into painful ingrown nails. The first critical mistake nail professionals make is recommending that you soak your feet before cutting your nails. While this makes cutting your nails easier, it actually increases your risk of developing an ingrown toenail. Think about cutting wet paper versus dry paper. Wet paper tears jaggedly, while dry paper cuts cleanly. The same principle applies to your toenails. The second mistake is using the wrong tools. Those curved nail clippers that you find at the drugstore, they're actually designed for fingernails, not toenails. Using them on your toes encourages the nail to grow curved at the edges, leading directly to ingrown toenails. Professional grade toenail clippers are straight across and much sturdier, allowing for a clean, straight cut. The third critical mistake is cutting your nails too short, especially at the corners. When you cut below the flesh line or around the corners, you're creating a pathway for the nails to grow into the skin. This is particularly problematic when combined with wet, soft nails that tear instead of cut cleanly. Now let me introduce you to the 2025 method for proper toenail care. First, always cut your nails when they're completely dry, ideally at least 2 hours after showering. Second, use professional grade straight across nail clippers. Third, leave about 2 millimeters of white showing, about the thickness of a nickel. And 4, never round or cut into the corners. But proper cutting technique is just the beginning. Let's talk about prevention, because this is where most people go wrong. Many people wear shoes that are too tight or too narrow, putting pressure on their toes. This pressure forces your foot to grow inward. Make sure your shoes have plenty of room in the toe box, and avoid high heels that push your toes forward. If you're active or athletic, your risk of ingrown toenails increases. The repetitive pressure from running or stopping suddenly can cause the nails to grow incorrectly. That's why proper shoe fit is even more crucial for athletes. Your athletic shoes should be a half size larger than your regular shoes to accommodate foot swelling during activity. In fact, forget about size altogether. Your athletic shoe should have the width of your index finger between your longest toe and the end of the shoe. That will give you the right fit. Let's address some warning signs that indicate you might be developing an ingrown toenail. The first sign is usually tenderness along the nail border. You might notice slight redness or swelling, and this is the time to act. Don't wait until it becomes painful or infected. If you catch it early, simple warm water soaks and proper nail cutting can often prevent it from worsening. However, if you notice increasing pain, redness that spreads beyond the immediate nail area, or any drainage, you need to see a podiatrist immediately. These are signs of infection, and home remedies just won't be enough. Attempting to dig out an infected ingrown toenail at home can lead to serious complications, especially if you have diabetes or circulation problems. Speaking of diabetes, let's talk about special considerations for people with certain medical conditions. If you have diabetes, peripheral neuropathy, or poor circulation, you should never attempt to treat an ingrown toenail at home. The risk of infection is too high, and even a small infection can lead to serious complications. Now let's discuss proper nail care tools. You'll need 3 essential items: professional grade straight across toenail clippers, a nail file to smooth any rough edges, and a good moisturizer to prevent the nails and surrounding skin from becoming too dry and brittle. Avoid using scissors or fingernail clippers on your toenails. They're not designed for this purpose and can cause damage. Many people ask about nail salons and pedicures. While professional pedicures can be safe and enjoyable, make sure the salon follows proper sterilization procedures. Bring your own tools if possible, and never let them cut your nails too short around the corners. Also, schedule your pedicure at least 2 days before any important events. This gives your nails time to recover from any minor trauma. Let's talk about long-term nail health. Your toenails can actually tell you a lot about your overall health. Changes in nail color, texture, and growth pattern might indicate underlying medical conditions. If you notice any unusual changes in your toenails, have them evaluated by a podiatrist. Prevention is always better than treatment. Establish a regular nail care routine, checking your toes at least once a week. Keep your feet clean and dry, wear properly fitting shoes, and don't ignore early signs of problems. Remember, ingrown toenails don't happen overnight. They develop gradually, giving you time to prevent them if you know what you're looking for. Thanks for taking the time to watch this video. I've written a comprehensive guide about proper toenail care that you can get for free at www.mytoenailbook.com. This book explains everything you need to know about preventing and treating ingrown toenails, including detailed instructions for the 2025 method. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're struggling with an ingrown toenail or want to learn more about proper nail care, come into the office and we'll get you taken care of right away. That link is in the description. Thanks so much for watching and have a great day.